A spate of pharmacy closings in Boston have drawn protests as more than 1,000 drugstore chain locations across the country have closed, reigniting long-standing concerns that low-income, Black and Latino Americans are bearing the brunt as pharmacies continue to disappear amid increased competition and other factors. In Chicago, almost a third to a quarter of the population lives in a pharmacy desert, and if you look at people who live in predominantly black neighborhoods, that's more than half of the people living in those neighborhoods, Xiaohan Ying, lead author of the 2022 paper, told Fobres. Walgreens has postponed the closure of a location in the city's Roxbury neighborhood, where Black and Latino residents make up 85.4% of the population, until January 31 following protests from residents, the Boston Globe reported Friday. The closure comes months after the company closed stores in Mattapan, Hyde Park and Lower Roxbury, also majority non-white neighborhoods. There are 18 Walgreens stores in Boston, according to the Globe, but only those in minority neighborhoods have closed in the last few years. In the last few years, all of the country's major pharmacy chains have announced store closures. CVS will complete the closure of 1,124 stores by the end of this year. Walgreens in June said it would close 450 of its locations across the country by August, and Rite Aid's bankruptcy filing came with announcements of almost 200 store closures. Rite Aid said the stores that were closing are those that have underperformed, and Walgreens said in a statement to Forbes that factors like existing footprint of stores, dynamics of the local market, and changes in the buying habits of our patients and customers are why some locations close. CVS, which plans to close 300 stores this year, similarly said in a statement locations are chosen based on local market dynamics, population shifts, a community's store density, and other geographic access points to meet the needs of the community. In some cases, rampant theft has been blamed for the store's closures. In October of 2021, Walgreens announced it would close 5 San Francisco stores, including one in the historically Latino Mission District. But Walgreens' chief financial officer last January admitted that the company exaggerated the claims of retail theft when it relied on the excuse to close the San Francisco stores. The claims fueled right-wing anger over a rise in crime before Kehoe said on an earnings call that the company maybe cried too much about retail shrinkage. Jenny Guadamuz, a researcher at the University of California at Berkeley, said the stores that close are almost always in Black or Latino communities. Because minority communities are more likely to have residents on public healthcare programs like Medicaid, which sees a lower medication reimbursement rate than many private insurers, it's likely true those stores are often a cost burden when compared to others, Guadamuz said.